Hey, happy Friday. I'm really excited to talk about Breech Babies today, and I'm sorry we're a couple minutes late getting on. I just realized that my clock that I was looking at was like 10 minutes off. I was like, oh, I'm late. So sorry about that. But yeah, we're ready to dive in here, and I think that this is a really interesting and great topic to chat about. And I think, of course, I want to start a little bit with some of the context of why, being able to do good massage work that could potentially open up more real estate for a breech baby to turn is even important, right? Because breech is just a variation of normal. So that, first of all, let's define what breech is. It's where a part other than the baby's head is what is presenting. It means that's the part that is pressing on the cervix and would be birthed first in the birthing process. So that can either be a baby's butt, bum, or their little feet. So anything other than the head, right? So breech babies have been born since, the dawn of time. They are a variation of normal. However, they tend to be looked at as much higher risk. And it seems like the longer time goes on, the more high risk they are. They are pretty much, at least in California, considered automatic C-sections unless you're really seeking out someone who is skilled at breech vaginal birth. And I think I have shared this in the past that, it hasn't even been that long that I've been in the birth world, but when I was a student midwife in 2010, breech births and twin births were still able to be attended by midwives at home. And not long after that, the laws changed. And so now it's very difficult to find anyone who has the licensure and the willingness to attend a breech birth or twin birth at home. And so you are likely going to have to go into the hospital. And then once you're in that hospital system, it's very difficult to find a provider who has any kind of, I don't want to say competence, that might be too judgmental, but who has the skill set and the confidence and the willingness to support a breech birth. And so that forces women right into a surgical birth. And all of this is just to lay down the context of why would your client be coming to you in sometimes a distressed or disappointed or less than optimal state because of her baby's position. And so I just wanted to paint that picture of why, because if she had a vision of having a natural birth, whether that was in the hospital or whether that was with midwives, and now her baby is breech, it can really start to limit her birth choices. And so I just think that that's really important for us as massage therapists to understand that, and what the cost is of having a breech baby. So now that we've kind of established that, and you understand that some of your client's birth choices might likely be on the line because of her baby's position, then you can understand sometimes why these clients are calling and asking and seeking any kind of help that might encourage their baby to turn head down. So with that being said, let me see if there's anything else I want to talk about. When we're doing massage work specific to helping babies turn, I also want to be really clear that we don't turn babies, right? That's way outside of our scope. All we're doing is creating more space, right? More space in the diaphragm, more space in the rib cage. That's often where I see a lot of restriction. We can absolutely create space in the pelvis, but I tend to see more of a restriction in the upper body with my breech clients. And so that's often where I will assess first. And so really all we can do as massage therapists, which is a lot, is to help create more room, help create more open real estate, help create more space for that baby to be like, oh, actually, I would prefer to turn head down, right? And so, of course, none of that is a guarantee that a baby will do that. It's just creating a better environment in case they would like to turn head down. And I also just want to say that babies are very intelligent, right? And so sometimes there's a very good reason that they are in a breech position, and that could be something going on with their cord that we wouldn't know about that as massage therapists. And so again, like, this is never about trying to force any kind of position, right? Because even external cephalic versions, that's where they're turning babies, you know, in the hospital, they are monitoring those babies very closely, because it is, it's kind of, it comes with some risks, is what I want to say, to be maneuvering a baby inside of the womb. So just want to be super clear that we do not do anything of the sort. We just create space. And if the baby would like to move head down and just couldn't before, we give them more space in order to do that. So, yeah, again, like, babies are intelligent. Sometimes there's a very good reason why they are in breech position, and it might actually be the best position for them. But I've definitely seen babies turn once we create some more space. I've had a couple actually turn on my table during the massage, which is like super rare, but very cool. And then I've also seen, you know, babies turn as late as like 38 weeks, where the percentage of that happening is very, very low. And women have come in and said, you know, I know that there's really not much of a chance of this happening, but I want to, you know, just check all the things off my list and just know that I did everything that I could for my baby to see if they will turn. And so we do all this work and we open things up, and they go, next time I hear from them, they're like, you won't believe it, but she turned, right? And so I guess the other thing that I think is worth mentioning is that before 32 weeks, if someone says that they have a breech baby, it's very often just sort of a snapshot in time. Before 32 weeks, there's just lots of room in the womb for babies to sometimes be heads up or sometimes be heads down. And so we don't really start to pay that much attention to baby's positioning until they hit that 32-week mark. And then we really want to start seeing baby like much more consistently in a head down position. And when I say we, I mean like the care providers. That's what they're looking for. But I think it's important as massage therapists to sort of know, when is it even relevant what position baby is in, you know? Because if your client's like 20 weeks, for example, it's like, yeah, that baby's flipping around and in all kinds of positions all the time because there's so much space. But right around that 32-week mark, that's when things start to, you know, the baby is getting to a more significant size, the open real estate is narrowing, and so ideally we would like to see a little bit more of a consistent head down position from that point onwards. So with that being said, let's chat a little bit about, like, what does our work look like for our massage clients who are coming in with breech babies? So we want to really think about lengthening and freeing up anything that is restricted. So things like doing work on the distal edge of the rib cage can be very helpful. Doing work that is, you know, in the intercostal space can be very helpful. That can also help free up the diaphragm. So we want to make sure that the diaphragm is free, that our client is able to breathe laterally and posteriorly. And any restriction in those areas is going to restrict, just how much space baby has in this upper torso. So those are some things that could be really helpful. The other thing that might not be as obvious is some of the other like more deep tissue sculpting work that does help with breathing and is not like directly influenced by the rib cage, but even doing, you know, scaling work, doing deep tissue sculpting in pec major. I also will do work under pec major into pec minor for my clients who have breech babies. Really, you're trying to free up the entire upper torso to get that lateral and posterior breath moving, and that is what will create a lot more open space for baby. So another great technique on the back as well is the paravertebral sculpting. So that is where you're tracking all the way through paravertebrals from the top of the spine all the way down to the bottom. It's when we say sculpting technique, that means that there's no oil. It means that we are allowing the tissue to dictate the pace that we are moving through it. And so the tissue is really unwinding and relaxing and yielding underneath our touch. And that particular technique, paravertebral sculpting, these are all referenced from Pre and Perinatal Massage Therapy 3rd edition, by the way, which we mention a lot because that's what we teach from. But that technique will really help open up the posterior lung capacity. So that's what we're looking for with anything with a breech baby, is to get everything to yield and to open up, and for a woman to be able to kind of unlock her diaphragm, unlock her rib cage in a way that will, create that extra space for baby. You can certainly do work in the pelvis as well, and that can be really, really helpful. I like to start with assessing the upper body because, like I said, that is what I have found to be the most prominent restriction with my clients with breech babies specifically. But that's not a hard rule. Like, you should assess, you should see what is going on in your client's body. And let me just see if I'm, oh yeah, Pam, I'm just blabbing here. I didn't think you were gonna be able to pop on. Hang on. We can get Pam on and then we'll get some more perspectives besides me. She's coming. It says adding. I think so. It says it's adding. Yeah, it's coming. She's coming in now. Hi.
Can you hear me?
Yes, I'm so sorry. I'm just blabbing away here. I totally thought we were going to be able to make this portion of it.
No, it's great. You're doing awesome.
Thank you. I was like, let me be quiet now. Is there anything else that you want to add to everything I've been chatting about?
I love that you were, and I don't want to interrupt you because I think you're on a good flow. I just wanted to reiterate that the upper body, that rib cage work and working pec major, pec minor, scalenes is so essential for the breech babies. I love, that you got right in there, and that's what needs to happen.
Yeah, beautiful. Yeah, because I know it's like sometimes there's stuff going on in the pelvis, certainly, but I'm glad you've seen it as well. Like, I just feel like when I put my hands on a mama with a breech baby, I'm like, ooh, this is where you're messed up, right?
Yeah.
So
and then just getting her to relax, I think, is also really helpful sometimes with the breech mamas, right? Because they start, even like you mentioned, at if they hear at 20 weeks that their baby's breech and they start freaking out, I'm like, no.
Right.
There's no reason to be freaking out.
Right. It's just a snapshot in time at that point. It's like your baby's breech right now, and 5 minutes later, they're not.
Yeah.
At 20 weeks. Yeah. Totally. And then, one of the other culprits too in the upper body that you might not think about for breech work is good old SCM here too.
Yeah.
And really getting this to lengthen and open up, because some mamas are using these anterior neck muscles to breathe with, and they're not designed for that, right? So anything that we can do just to unlock all of this, I think, is very, very helpful for the breech mamas. And you're right, like, they are understandably often highly stressed because of all of the limitations that come along with that position, right?
Yeah. I think it's really important. You mentioned the SCMs sometimes get used as like a primary muscle in the breathing, but to give them diaphragmatic breathing exercises, but to assess first that they're not using their upper lungs, right, that upper rib cage to do the work, that they're doing true diaphragmatic breathing. And so we can definitely offer them some instruction there and some guidance.
Yeah, beautiful. And then do you normally, I know you do a lot of guided work with your clients, which is so beautiful. I will often turn to that visualization of imagine if there's a small umbrella underneath your rib cage, that you're opening the umbrella, right? And we're giving them some tactile, that's what you use too. I love that one. So I'll place my hands on either side of their rib cage, right? And it's usually like this, right? Because they're side lying. So it's a ceiling hand and a table side hand. And I'm asking them to visualize that there's an umbrella under their rib cage, right? And as they inhale, they're going to open that umbrella and they're going to try to move my hands with their rib cage as they're breathing.
Yeah.
Yeah. And then you can also place your hands posteriorly on their rib cage, which is going to be a little harder for them to do. So I like to start lateral, because if they get the lateral, then they can usually get the posterior breath as well. Yeah.
Yeah, and I use the wording sometimes of taking a full body breath, just to breathe, like get the imagery of like their whole body expanding in space time. So
Love that.
sometimes that works for some people. You have to kind of play with the visualization. Some things work for some and not others.
Right. Right. Yeah, no, that's a great reminder too, that yeah, how we're describing things is really helpful. Some of the other things that you could think about, I usually see these as like secondary, but they can also be very supportive techniques for a breech baby. Is just thinking about creating space between the rib cage and the pelvis. So doing some of that QL work, doing some of the pelvic mobilizations to help lengthen the obliques and things like that. Just getting more space between those bottom ribs and the pelvis can be very helpful as well.
So Sparrow, do you assist in any inversions in the office?
I don't, but I definitely, what I was going to say is I feel like the majority of the breech clients that I see have already like checked all those things off their list, or they're already doing all those things. Yeah, so no, I don't see like as much of a need for that, but yeah, I would love to hear what you do in your practice, especially if there's a mama who hasn't done that or doesn't know about that.
Yeah, I find that a lot of times if I have someone who's coming in with a breech baby, that they often aren't, well, I don't know, maybe it's 50-50, that they don't know or aren't aware of some of the other balancing exercises they can do at home on their own. So I'll direct them to these. I'll often teach them the 3 balances, which used to be the 3 sisters, right?
Yeah.
And sometimes we'll do that gentle inversion where,
Oh, I think you cut out for a
they're
second, Pam.
like a bench and
Oh, you're cutting out. We can't quite hear you.
I'm sorry.
I know you're driving, but I think you're describing, I think you said that you have them up on a bench and then probably their forearms down on the floor, so pelvis up in the air. Is that what you're saying?
Yep, exactly. Yeah.
Yeah. So yeah, and that can also help all of the ligaments surrounding the uterus, particularly sacroiliac ligaments, to reset themselves, right? Because it's like when you have gravity constantly pulling just downwards, those ligaments don't really get a break. But when you get the pelvis up in the air, it allows baby to kind of come down out of the pelvis for a moment, and those ligaments can kind of reset themselves before she stands back up, and then all that gravity comes back down on them again. So yeah, that can be a great thing to let your clients know about. All of the breathing stuff is great. Yeah, and I think too, for a lot of clients, like I mentioned earlier, like they just want to know that they did everything that they could, right? And like I also mentioned, sometimes there's a very good reason why a baby is in a breech position. And so I just like to like let my clients know like that they've done a great job, that they've done everything that they can, and that sometimes breech really is just a variation of normal, and there is some discussion that I've heard that the chances of breech babies is actually increasing And I don't know exactly how much evidence we have with that, or if it's more anecdotal right now. But some of the things that I hear discussed often is just the increase in sedentary lifestyle, and also the increase in the prevalence of fibroids can sometimes be a like mechanical factor, and that baby can't get around the fibroid to get head
Yeah.
down. Yeah. So there are some things, I think that there are like, some multiple truths. Like, yes, breech babies have always existed. There's possibly, an increase in the incidence of breech birth or breech positioning because of some of our like modern day stuff going on, whether that's, yes, sitting for long periods of time, or increased chances of fibroids large enough to like really get in baby's way. And fibroids also tend to get very well nourished during pregnancy, so sometimes they can actually get bigger during the course of pregnancy, right, Pam? Oh, did I
Yeah,
lose
we
you?
often see that happen. Yes.
Yeah, because all that juicy blood flow, right?
Yeah.
They're like, thank you so much. So, um, yeah, sometimes
Hormone
that can be a
production, extra
factor.
blood flow, and circulation. Yeah.
Yeah, all of that. So those are just some things to think about as massage therapists. I hope that you're walking away with a better understanding of, what's at stake for some of your clients, why they might really be determined to do everything that they can to try and help baby turn, why they might be very stressed out about it, and then also like what you can do for them. Because there's a lot, and even if you were to do like all of that upper work and baby didn't turn, the fact that she can breathe better is still going to serve her
Yeah.
hugely, right, in her pregnancy, and in feeling better, and likely reducing anxiety, right?
Yeah, absolutely.
Yeah. Are there any other questions or things that anyone wants to add here? Just looking for comments. Yeah. Pam, have you had any like interesting stories? I shared a little bit that I've had. It's very rare, but I have had a couple babies actually turn on my table.
I heard that. I've never had a baby turn on my table.
Mm.
I have had babies turn, but like after the massage, and I
Yeah,
have in the past used Moxa. It's questionary. I'm not going to go in there, but I have done that and had babies turn. So,
beautiful.
um, yeah, it's it's just always a gift when they turn. They don't always turn. Sometimes they just. I think it's also important to, remember, like you said, some babies are just meant to come in this world, you know, not not head down, and we don't know why, and so we're not trying to force anything to happen. We're just gently assisting.
Right, 100%. Yeah. And do you have any stats or stories like on any clients? Like, what's the latest that you've seen someone's baby turn after a
I
massage?
don't have any stats, and let's see, do I have any good breech stories? I had a client whose baby had been, you know, perfectly fine, head down in position, and at like 39 weeks, we were sitting and talking, and he turned right then and there and remained breech. We couldn't get him to go back. So, strange things happen sometimes.
And what was her birth trajectory like after that? Was that a C-section?
It was, yeah. So that is something I think is important to mention, is that, in this country, we've really lost midwives and doctors who are willing to deliver breech babies, and it's a shame. It's a skill that is far and few between, but it can be done, and it's if you can find a provider who is willing and that has the knowledge and the wisdom to do that, it's worth seeking them out.
100%. Yeah. 100%. So when I was a student midwife and I went to do like an advanced training with Elizabeth Davis, who some of you may know is one of the very long-standing um, like direct entry midwifery instructors. I happened to be in a class at a time where a lot of longstanding lay midwives, meaning unlicensed midwives, were coming in to get their licensure, but they had been practicing for years. And there was a woman in my class who, you know, was like a 20+ year lay midwife who brought in an album of over 100 breech births that she had been to, of just all
Wow.
the different presenting parts, you know. And so we would see like little babies that were born that had, you know, like all the suction marks on their little bottoms, you know, because that was what
Yeah.
was sitting on the cervix the whole time. And it was so cool to be able to see how normal it can be, and how that was just like such an integrated part of her world. And it was something that she had tons of experience with. And then to contrast that now with, like you said, so many of the care providers who have lost and who are losing those skills, and who, especially the OBs, you know, we talk about this all the time, but they are primarily, especially the newer OBs, being trained first and foremost as surgeons, and so their problem solving goes right to C-section.
Yeah. Well,
Yeah,
that's amazing. What a beautiful story, and what a gift to have met her. But I
so
think it
cool.
also goes to show that breech babies, you know, it's uncommon, right? It's not like the way we want them to come in, but it happens all the time.
Yeah, yeah, all the time. So yeah, but I hope that this, you know, both gives you a little bit of context of, yeah, what is breech, you know, what's going on politically with options for breech mamas, and of course, like things that you can tune into as a massage therapist, and lenses that you can look through, to again just help create more space. And lots of times those very smart babies will be like, thank you, and um,
Yeah.
make their move after that.
Yeah.
Yeah. Beautiful. Well, is there anything else that you want to say on this before we end for today?
No, sorry I wasn't with you guys in person, but thanks for being patient with me.
Oh, for sure. It's so nice to have you. I'm so sorry that it took me a minute to realize that you were there. So, um, yeah, I always appreciate the back and forth, you know, and the stories and camaraderie that we have. So I
Yeah.
yeah, I appreciate you. I hope you get where you're going safely. And thanks for everybody who's watching live, and for everybody who watches the replay. If you have any questions, always feel free to drop them in the chat, and Pamela and I are happy to answer. So thanks everybody.
All right, have a great weekend.
Have a great weekend. Bye.